everyone. As we gather today for this session on healing hearts, navigating grief, and for our health and emotional freedom, let's begin with a small meditation to help us center and to get engaged in this space. So just feel comfortable. Allow yourself a moment to settle in. And just take a few deep breaths. And with each breath in, imagine drawing in peace and awareness. And with each breath out, releasing any distractions or discomfort you may be carrying. So just practice a couple of breaths in and out. And now gently turn your attention to any feelings of grief or emotional pain you might be holding. Acknowledge these feelings. Understand that they are a natural process or natural response to challenges that you may have encountered. And those emotions, while often they are heavy, are valuable guardians to our deeper selves. And today we are not here to push these guardians away. Rather, our aim is to understand them, to learn about their presence, and to find ways to comfort and assure them as we seek to connect to our core selves, a place of inherent compassion, strength, calmness, and clarity. During our session, we'll explore these emotions with kindness and openness. We will listen to what they are here to tell us, embracing each one as a part of our unique journey. And this is a path of self-discovery and healing, leading us from the depths of grief or health challenges to the shores of emotional freedoms. So let us enter into this session with an intention of healing, learning, embracing all facets of our experiences. Thank you for being here and for your courage to take this journey. Now, session today, we'll get a little bit into understanding grief and what is the connection between grief and health. We will look at benefits of healing the heart from grief, and then we'll do a little bit drill down into the process, a process that we are then going to experience or go through together using IFS, and then we'll follow it with sound healing so that we can solidify or release whatever comes up. And then at the end of the hour, as usual, we'll get into live Q&A where your experience, if you have any specific needs, we will walk through them together, and I'll do my best to answer. And sometimes, and more often, we learn from each other in that session. So let's get into this subject. So a little bit of what is grief. Now, grief is an emotional response to a loss, which can encompass a wide range of feelings or emotions from deep sadness to anger. For example, if someone may feel a sense of numbness and disbelief after death of a loved one, which is then followed by periods of sorrow and longing. So then it becomes a very long experience. That's what grief does. Now there are different stages of emotional states which can be associated with grief, which can be denial, anger, bargaining, depression, and acceptance. And this acts like a framework to understand that this is how the grieving process typically works. However, the idea is that sometimes we get stuck in an aspect of that emotion, and so this is what we'll do, is to understand where you are, because one of that emotion will tell you where you are associated with the loss in your grieving process, and then to help you move forward quickly. And people react differently. So for example, a person might deny the reality of a loss in the beginning and then go into accepting it eventually, but they may also get stuck in between. And as I said, there are differences between how people process grief. So grief is a highly personal experience and can vary greatly from person to person. Now, levels of self-energy plays a big role in how people may go through grief from loss. So if, for example, one individual may openly express their grief while another may withdraw and grieve in solitude. So I lost my father about 5 years ago, and I could observe that my expression of grief for my father loss was much more expressive, but healed faster. My wife lost her mother a few months ago, and she's doing much more in solitude and is taking much more time. So I could see there's a difference. So just both of us lost parents, but we have very different perspective of how we are processing grief. So everybody does it differently. There are physical symptoms that can accompany grief, such as fatigue, changes in appetite, sleep, insomnia, alongside with emotional effects like anxiety, helplessness, panic attacks, etc. And so someone who's grieving may find themselves often tired, or may have issues to sleep, and may start to experience anxiety in situations that are previously they felt comfortable. So after loss, something changes in the perspective because of how you're expressing the loss or the grief. And coping with grief, it's always advisable to seek healthy coping mechanism, such as seeking support from loved ones. I mean, this is one of the best ways, or professionals. Expressing feelings through writing, art, or practicing self-care, like we are going to do. It's constructive, and it's a healthy way of coping with managing grief. So in summary, grief is a complex and deeply personal response to a loss that can manifest in many ways, both emotionally and physically. And understanding grieving process is unique to each individual. And hence, knowing that this is different from one to another gives you more understanding of how you can deal for yourself. And so by understanding the stages as well, it gives you more perspective. Now, how is grief connected to health issues? Okay. So there are psychosomatic response. Often grief manifests into symptoms that can be somatic as well. Okay, which can be distress that leads to physical health problems. Okay, people have headaches, insomnia, stomach aches, uh, physical ailments without a clear medical cause, because that's how their body is responding to the emotional pain. Stress is one of the big things when it comes to, because your body goes into fight or flight response, which can then strain your cardiovascular system or overall immune system, that then has long-term health issues, can turn chronic. Behavioral aspects, so grief can lead to unhealthy behaviors, such as poor diet, lack of exercise, alcohol, substance abuse, or neglect of medical care. I have a client that I'm working with now in the recent time, who is an addict, and his core issue was grieving losses. He started having losses at the age of 5, and he had 6 losses by the time he was 14, and by the time he was 15, he was he became an addict, substance abuse. because that was his coping mechanism. So the pain of the loss is substituted by a drug. So that becomes a coping mechanism. Grief can also exaggerate mental health conditions like depression, anxiety. So if somebody is already sitting on something which is delicate pre-loss, then it just becomes more profound. And so the two compound together. So if you are already into a place where you are holding some form of other issues, and then comes a loss, then it just gets compounded, grief compounds, and then it becomes much more into a chronic health condition. And then there is all aspect of social withdrawal, isolation. So one of the classical things is if you do not have a social support system, then you tend to go inside because that's a protective mechanism. And that's why a lot of people go inwards, which then create issues of sort of that you do not have any more social interaction, and then that creates other complications. So grief can significantly impact health and overall well-being. So symptoms of griefs are many, and understanding this connection is key to addressing grief holistically and supporting yourself in your healing journey. So which means you can associate some of the health conditions into at the root of having loss and still grieving from the loss. Now, some of the benefits of doing this work, emotional healing after grief leads to reduced symptoms of depression, anxiety. Okay, it starts to create more positive and stable mental states. I have many examples of working with people who process loss of loved ones and find their daily mood improved and have far fewer episodes of sadness or worry. I had that experience when I had my father, but a lot of people I work with, this is one of the things that comes up a lot, grief. Addressing emotional pain can also elevate, of course, the psychosomatic symptoms, improving sleep quality. I mean, pains and all kinds of panic attacks start to disappear or reduce significantly because your energy level goes up. You're much more sure about yourself, and you're no more living in that space, but much more into other space. Okay. And of course, then what happens as an outcome is you start to create space for more open communication with others because you feel safe to be outside, to be with the external world, which is what was the case before. And then loss then made you go deep inside. And then that helps to create more friendships, even connection back with family. Sometimes we lose connection to the family as an effect of loss, grief. And of course, if you are into building your life on top of everything else, then dealing with grief actually leads to self-discovery and greater resilience, which then starts to create an aspect of much more appreciation for life. So gratitude comes in, and which then can help you to create, into your career paths or relationships or wherever you want to take your life forward. So when people say, I'm stuck in life, grief sometimes plays a big role into working through. So by processing grief and learning to cope effectively, individuals can emerge much stronger and resilient. Okay, so what is the process? So in the context of what we work, and which I've seen in many other cases, in whatever mechanism you use, but in the context we use, it starts always with the awareness. So you acknowledge the grief, you become aware of which means that a person might start to recognize their feeling of sadness and loss rather than avoiding or denying, because it's painful. And hence what we do is we start to put it under the carpet. So here you acknowledge and you become aware of. The second step is always exploration and understanding the emotion associated with the loss or grief and accepting them without judgment. Now, one very important aspect of when you connect to the associated emotion there's always a judgment that comes in, which means either there's a anger, I didn't do enough, I could have done something different. So it can be an anger, it can be an external oriented anger. If somebody got lost because was in a hospital with, or was in a accident or something, so external factor, then there's a sense of huge anger. There's a guilt which comes a lot, which is what if I had done differently? Okay. I had an experience recently where my daughter-in-law lost her, had to put down her dog, and it was incredible how much, poor thing, how much guilt she went through of doing that act. And it had to be, only way she could compensate her guilt was to understand that I'm feeling guilty, but what she did was the right thing. And so that helped her to process it. And then now she's much better within a month. It's amazing how that when you start to understand and associate and move on, how it changes. So judgment on the emotion is a big part, and we'll look at that today as well. Self-compassion and acceptance, which is the part we do, which is, can we look at that aspect of the one which is grieving from the loss much more from a care, much more from compassion and from kindness. And so that changes the perspective towards it, and hence it starts to be less in a state of either denial or guilty or angry or one of those 5 states. And then what we do is we then go into connect to the inner strength. Now, identifying and connecting to inner strength can aid in the healing process. Somebody might discover resilience through reflecting on the past challenges that they have overcome, or find support in their values, or have a spiritual awakening. And so a lot of things that come up when you start to look deep inside without that emotion of guilt, shame, anger, etc. coming in. And you start to see the gifts that it brought. And then, of course, moving forward, engaging into new hobbies, you start to find your path forward. So that's the whole idea. Okay. So this is what we are going to try and do in the session now. Okay. And so in order to help you identify some aspect, I send you questions. I want you to take a moment. And what you can do always is to make a list, because the way the session is organized is that you don't have to work on all of them, but even if you have a list of them, you can always go back and start from this point to work through a list. So it's not an issue that you have more than one, but start by making a list. So you can do from 2 aspects. If you had a personal loss or a significant change in your life that continues to impact you today, just make an identification of that. Or moments in your life where you faced a death, really health scare or a challenge for yourself or a loved one. And if there is emotions that have emerged through time that influence how you look at perspective on health and well-being, it helps, it impacts your own view of well-being. So one of them or both of them, and just make a list, and then we will start. And see if you can, while you're writing, see if you can choose one that you would like to work. See if you can choose one of them. Okay, so find yourself into a place of relaxation now. Be comfortable. Make sure your body is in a position that allows it to feel relaxed and at ease. You can keep a paper and pencil next to you, and you can always open your eyes and write whatever comes up. You can do it at the beginning, in the process, or you can do it at the end. Both are okay. Now to begin, just focus on your breath. So draw in slowly deep breath through your nose, filling your lungs entirely, and then exhale through your mouth and letting go any tensions or worries. Breathe in again and then breathe out. And just do a scan. Go from top of your head, through your head, into your shoulders, into your chest, into your belly area, into your hips, into your legs, and just notice if there are any sensations that you already feel in your body. And you don't have to do anything, just observe. You're doing like a scan. Now gently shift your attention to the issue you chose to bring into the session related to grief. Just invite it in. And as you invite it in and you focus on it, observe any sensations you feel in your body, around your body, or if you see any images. And you have some emotions that are surfacing. Just observe. Any sensations, any images, and kind of emotions that are emerging, or even some thoughts that are coming to surface. Become an observer to them. So move your attention to the physical sensation or the images if you see an image. And just notice what kind of emotion that is coming up. Feeling of discomfort, tightness. And see if you can direct your breath into that sensation, into that area in your body, or towards the image. And allowing each exhalation to create a space for relaxation and release. Breathe in and breathe out, directing your breath into that sensation. And now make a check. How are you feeling towards this sensation? Do you feel anger? Do you feel fear? Do you feel guilt? Or any other emotion like that? Just notice it. Don't do anything. Just observe that how do I feel towards this sensation? And as we are doing this exercise, just see if you can become curious. Compassion will be good, but curiosity is good towards this part that is revealing itself to you. Just see for a moment if you can become curious. And if you feel there's a lot of judgment that is coming up, or a lot of thoughts that are coming up, you can always ask to a part of you that is judging, saying, can you please go into a waiting room? You can request it to go to a waiting room. Normally they do. And allow you to focus on the sensation in your body or an image. So just be curious as to know what information it holds. What can I learn more about? And so from a place of curiosity, if you could be there, ask a question toward the sensation or the image if you're seeing an image. Ask it, what is your intention for me? And notice what you hear. What do you want for me? What do you intend for me? And if you want, you can take note, but just notice what you hear. Stay curious. And if you feel compassion towards this, what you hear, you can be also compassionate. And from a place of curiosity and compassion, ask, what are you afraid would happen to me? What is your fear? And notice what you hear. If at any point you feel you're being disturbed or there's a part of you judging, etc., you can always ask the judgment part or the part that is thought which is coming in to disturb. You can say, can you go to the waiting room? You can always ask anytime. Normally they do. So go back to understand what is it afraid would happen to you. And ask your following question. Well, if that happens, then what are you afraid would happen next? And notice what you hear. And now ask, what are you really, really afraid for me? What is your ultimate fear for me? And take note of it. And remember, when you're hearing it, this is a part that is telling you what is it protecting you from. So just be curious and compassionate. So what you hear is what this part is protecting you from. Is the real ultimate fear. And see if it makes sense what you hear. Does it make sense? And if it does, can you acknowledge to the part and say, I understand, and see how it responds back to you? Now ask another question. Do you like playing this role for me, or you have to do it? Or in other words, if you had a choice, would you do something else? And see what you get as a response. Do you like playing this role for me, or you have to do it? Take note of what you hear and just acknowledge. And now ask a question. Since when are you playing this role for me? It'll give you an age, and it may also show you what was happening then. Remember to stay curious and compassionate. So your question to this part is, since when are you playing this role, and what was happening that time that made you play this role for me? It may show you a time, or it may show you in that space going through certain challenging time. So remember, you have to stay compassionate and curious. Just acknowledge it. And if it's showing you events that happen then, just stay in a place of compassion. Because it may be showing you something which can be in a form of trauma that happened in a younger age that it is holding. And you can always tell it, well, if you give me permission, then we can work on that later. And see what you get as an answer. Now ask it, what needs to happen for this part to relax and be less present Meaning, what should happen before this part can be assured that you are safe? Wait for the response. Notice what you hear. And does it make sense? If it does, take note of your actions to do and acknowledge your understanding to the part. Say, I understand it. And ask it, how can I call you? Normally, parts can name themselves. So just ask it, saying, how can I call you? What name should I call you with? Because I'm going to come back to you, work with you. So what name should I call you with? And take note of the name that you get. And it doesn't matter the name that comes up. Sometimes parts call themselves A, B. It's okay. Any name. Thank it for coming in today, for its presence, for letting you know what it did. And let it know that you'll come back, you will revisit this process, and if there is a need to heal a little one, younger one, you will take its permission and work with the trauma or whatever little one that it showed when it shed the age. So just let it know. So I will come back and I will work. And if you do commit to it, then you commit to yourself to come back and do it. And you'll have all the resources to do it. And just thank all parts that came in, worked with you directly, or the one that were put into the waiting room. Just let them all know you're grateful for them to come in today. And you will come back regularly to work with them. And when that feels complete, just start to come back. Keep taking notes if you want to. And we'll prepare for the tuning fork part. Okay, so we are going to go through the tuning fork session. Just to remind if you're first time here, so what we do using tuning fork is work on the biofield. And the biofield is your field, which is about 6 feet both sides and forms like this torus that you see here. And the premise of the tuning fork or biofield system is that basically in your biofield lies your different experiences, some of them which are still troubling you. And using tuning forks, we can go there, identify them, and work to release them. Okay. And so the way we do it is we start by opening the two channels, one on top of the head and below the feet. so that we open this channel, which is all your center, okay, using tuning forks. And then using a pendulum, we go and find out based on what you brought in today, which is why you're here, okay, your intention, which then opens up what needs to be cleared. Okay, so we'll bring all of your energy here and then we'll work through it. And so the thing for you to do is what you have to do. So you have to breathe with me. So breathing helps to release and to process. And I will tell you breathe and you just breathe. And the breathing is a little bit unusual. So the way you breathe is you take a deep breath into your and fill up your belly, and then you breathe out from your mouth as if you're releasing energy out through your feet actually. So you breathe in from the top of your head into your chest area, belly, fill it up, and then release it down through your feet. Sometime when it's very difficult, challenging thing, then I may also feel it and I will tell you, okay, do something like okay, and you release. You can make noise, you're mute, so it doesn't matter. Okay, all of that is to help you release whatever comes up, and then we'll finish it. Okay, so here we go. I'm going to switch off my video. I start, you will hear me of course, and I'll start at the bottom of the feet, top of the head, and then wherever the pendulum tells me the center or chakra to work with. Okay, here we go. Okay, so I will open below the feet using specific tuning fork. So this is a 174 Hertz. Okay, here we go. Take a breath. And below your feet, and I'm pointing towards top of your head, opening the channel from below the feet to the top of the head. And you can always imagine that as well. Okay, take a deep breath in and release. Yeah, think of your wish while you're here. Okay, I'm going to ground you. Take a breath. Okay, now we're going to go to the top of the head. Open the channel from the head. So I'm now pointing from the head down towards the feet. This is to connect you from divine down to Mother Earth. Take a breath. Okay. So this has been open. I'm going to run a pendulum. You'll not see anything, but I will just tell you. So it starts from the feet and goes to the knees and then all the centers. Biofield system, even knees and feet are important. I'm at the root chakra, sacral, solar plexus, heart, throat, then coming down, Okay, sacral, second center. So it's saying work on second center on the left side. So this is a sacral, so it's intimacy, creativity, sensuality, self-worth. This is what it is, and it's all about frustration and disappointments. Okay, so I'm going to go to the left side, go to the edge of the 6 feet. This is where we'll find the timeline. So we start from when you were at the time of your conception. And then we'll go through different ages, okay? So I'm going to use a different tuning fork. This is 144 Hertz. And we'll start at the time of conception, okay? So I will tell you an age and an emotion that may come up, and you just connect and you breathe and you release, if it makes sense, okay? Here we go. So this is at the time of conception. Yeah, as usual. It's straight into the second center. So the word that is coming is acceptance. I want to be accepted here. So it's not complaining, it's saying, I want to accept. So see if you can just say to yourself, to the little one, that you're accepted here. He's not complaining, he's asking to be accepted. So take a breath. If any of you feel constrained to accept, just take a deep breath. I'm going to run another tuning fork just to clear the path. So you're telling to the newborn, the one who's just coming in conceived, saying you're accepted. And there's a bit of sadness coming in, but just see if you can take a breath and release it. Go back to compassion and love for the little one. Let him or her know that he is accepted. And if you feel any doubt, anything coming in, just send love. Yeah, you did it. Take a breath. It moved. So the baby is still in the womb. Is feeling a little anxious. It's as if saying, "Oh, I'm accepted. Now I have to come into the world." So just before being born. So can you send love and compassion and acceptance to the little one, to the mother? There you go. Okay. So now we are at the time of birth. So the little one is wanting to say something. So if something is coming as an expression to you, because it's feeling very tight in the throat, it wants to say out loudly, take a deep breath out, as you want, just release it. As if the little one wants to say something to you. He or she is a messenger, so listen to the message. Take a breath. Whatever is the message, just send love and compassion to the little one and to the mother and to the nursing staff and whoever is around you, taking care of you. Your little one is still anxious. I'm going to say it. So it's saying, I want to tell you why I'm here. Can you hear me? And see if you can hear and embrace it. Hear her out. Him or her. Yeah, wants to say a lot. Okay, done. Okay, so it's 18-year-old now. Now the 18-year-old is coming up and wants to say something. Yeah, he's expressing, this is in the second center. So frustration, disappointments. Can be around intimacy as well, challenges. So see if you can just send love and breathe into that. I'm going to use another tuning fork to release. So I'm in the present moment. So now, so just breathe and send love to yourself now. whatever is coming up in form of sadness or any form of sadness, just release it out. Okay, so now it's taking me to your mother zone. So it's what your mother could have gone through in her life, in her childhood, that is here. It says a lot has been released, but there is a little bit still remaining in the second center. So just breathe into that and release it out. This is between you and your mother. Okay, so now I'm on top of your second center. So whatever we have collected, we're going to release it out. Just breathe. Okay, we are going to close it. Take a moment. So whatever changes have been done will continue to work for the next 48 hours. And just cocoon 520 hertz, 8 hertz. As we conclude our session, let's take a few moments to integrate all the insights and healing experience we would have explored. Bring your awareness back to your breath. Inhale deeply, filling your lungs. Exhale slowly, releasing any remaining tension. Remember that just like a family, our inner world is made up of various parts, each with its own roles and intentions. We have engaged with some of those parts today, offering understanding and compassion. Now take a moment to acknowledge and appreciate the parts that showed up. Recognize their presence and valuable role they play in your life. Thank them for their willingness to share and for their efforts to protect you and support you. See if you can reassure your inner system that you will continue to work together, fostering unity and harmony among your parts. Let them know that you are committed to their well-being. As we conclude, trust the process and may you find peace and healing along the way. And take one final breath and exhale any remaining tensions or worries. And when you're ready, you can open your eyes and be back.